It's Dr. Cameron, and we're back in San Diego at the ILADS Conference. And one of the things that has actually happened, is this movie called Under Our Skin, and it's and I have one of the stars of Under Our Skin with me, named Dana Walsh, and so I'm going to ask her a few questions and have a few minutes with her. So Dana, thanks for coming.
Thanks for having me.
Now, it was a while, that movie was a couple of years ago, but what role did you play in that movie?
Oh, well, I was sort of the person that represented the one that looks fine, but is out in the world basically carrying on, but dragging my body behind me. I was in incredible pain, head to toe. Misdiagnosed with fibromyalgia for about 5 years, and then finally a Lyme literate doctor found Lyme disease in me. Yeah.
So, yeah, it's very easy in my practice to see someone have a diagnosis. Fibromyalgia is one of them.
Yes.
Chronic fatigue, multiple sclerosis, anxiety disorder. And it takes a long time for them to realize that what happens if the doctor isn't right. So at some point that you were, you might have fit both definitions.
Yes.
But somebody came along and said, why don't you look at Lyme disease instead of just accepting fibromyalgia as a diagnosis?
Yes, that's right. It was a woman named Beth McDougall, who's here today. It was wonderful to see her. She said, I just am not buying this fibromyalgia. I'm seeing too many other things in you. And she tested IGeneX, and there it was.
And when you got started on treatment, you were still working?
I was.
Because I find that when someone is working, they've already cut out friends, they cut out evening life, they cut out a lot of things. So you probably weren't doing much other than work.
Well, let me back up. I went on tour with the band U2 when I was very sick and without treatments, and that's what they cover in the film.
Okay.
I really needed the money to get the treatment, so I went out on tour, and it nearly killed me. It was very powerful. And then after that, I was to the point where I couldn't work. So
they caught you at the time where it was almost impossible to continue, but it wasn't just work then. In addition to not being able to work, you that's where you were in severe pain.
Yes, and by the time I started full-time treatments, I had about 12 different infections, and all of the co-infections and multiple mold problems, viruses, et cetera, et cetera. So.
Yeah, we talked earlier in the streaming about all the different infections that can be in the same tick. That a tick transports into you, but then things you would probably normally not experience, like mold, the types of things you eat, or having a drink, would be all problematic.
Yes. Yes, and I was in the music business, and it was one of the indicators when I would go out to a show and have, a cocktail and black out. Yeah. That was one of the first things that...
So when you got treated,
yes.
After being sick that long, it usually takes a while. It's often a journey.
Yes.
Of getting worse sometimes, getting better, ups and downs. So how many months did it take for you to start realizing that you were going to get better?
Okay, so by the time I started full-time treatment, it had been 6 years misdiagnosed, and I went in full-time, and I didn't see any change until about a year of on and off antibiotics and different treatments.
So there might have been some changes, but where you really felt you were on the right track.
Oh, things would leave me. Yeah, things would.
Okay.
Yeah.
Often I call it a journey. There's some changes,
yes.
Brief gains, and then it slips back,
yeah.
or part of the day is better, and then by mid-afternoon it's all back again.
Yeah, pretty much.
Do you remember those feelings?
I do remember that, and then when the symptom actually leaves, it's almost like you don't even remember it anymore. Like, I remember chopping vegetables and thinking, I'm not burning. not burning anymore. You know.
So in other words, you adapted, but you adapted and eventually got to such a low level of health that you forgot what normal was.
Yeah.
Yeah. So I think when that movie came out, you know, that like Mandy, for example, has done quite well. The blonde that was in the pool. The ranger. I met Mandy, and she was doing great and the ranger who had said, I think I'm getting there after 2 years. When I met him, he was right. He had reached that spot. So you reached a spot at some point where you're doing pretty well?
Oh, I'm doing great. I'm doing great. You know, I think I was always a sensitive person even before Lyme. I had a lot of childhood infections. And then when I got hit with it, I really went down. And I've been really, really good. I have to watch, you know, a lot of things, but.
Yeah, I find that a lot of people who've had Lyme and are doing relatively well.
Yeah.
If you ask them, they're more delicate. They're still a little more susceptible to what they eat, to stress, to sleep, and so they might not feel that ill.
Yeah.
But that there is a change.
There is sort of like the fallout from all the illness and the treatments, and so it's an ongoing maintenance. You know, I only flew down from San Francisco, and that little flight knocked me out. So I'm still pretty sensitive.
Well, I think that one of the things about that movie, you know, which is that in that movie, Under Skin is shown in a lot of communities. I have spoken after the movie to groups. And so the ranger and Mandy, I always could say, by the way, you know, that even they made it. Yeah. So I can add you to a success.
Yes, you can.
Well,
yes.
So it's nice because, you know, sometimes, you know, you never hear success stories. You know, even if it's not so good, and you have times where you thought, well, I'm sure you must think you got robbed once in a while.
Oh yeah, yeah. I was 29 when it all went down, so I feel like I lost all of my 30s, but
yeah, and I think that different people have had various losses, but it's a shame when it's a tick, and all the things that are a tick, you know, bring you down, as opposed to like an accident or something else. This one is, and also it's a shame when half of it was just having the wrong diagnosis, the wrong direction. But it would likely have gone a lot quicker if you had been treated earlier.
Oh yeah, yeah, absolutely. And you know, what I'm finding in all of this is there are also a lot of gifts that come from this illness. There's a lot of community, there's a lot of support, and I'm really trying to help on that level now, because if you can't be in the moment, in present time, if you think about all the time that's lost, it gets so depressing. So I'm sort of on a campaign now, offering support for people to stay with where they are and keep moving forward.
Now, we had talked a little bit earlier about irritability. Bob Bransfield was talking about it. It was described as part of the chronic neurologic Lyme disease originally. I would imagine you probably had some irritability and some mood issues for a while. I can't imagine you ever being irritable. But was there a time where you had some of those emotions at the time?
You know, it comes and goes. It's like a big, overwhelming flare. I did have those emotions, definitely. And there is that sort of, like I said, that isolation Lyme patients feel. And
well, I often talk to people about that despair, even though it's fleeting. It's not all day.
Yeah.
And they feel like they're the only one that nobody can feel that bad. But then the next person thinks, well, nobody can be that bad. But then so it's it seems to affect the core enough where you lose track of where everybody else is, and that's and that type of feeling, even if it's not as bad anymore, it's very easy for someone to say, "Oh, that's psychiatric. That means you got to go to take antidepressants." When it's only a piece of the issue. It's not even the main issue, but it's an important one. It's memorable, but there's all these other issues that if the doctor looks underneath it, would see a different picture if they asked a few more questions.
Yes, absolutely. And you know, even there's that time between doctor visits that I think the depression really sets in, because the time with a Lyme literate doctor is like, it's like heaven. They can see me. They know what's going on. Then you go out in the world, and it's kind of a scary place. And so I've been walking around and at the conference today and seeing all these doctors that help me, and I just feel so grateful.
Well, I think that if you look at ILADS as a society, is that you're right, is that it's a different world because they look at Lyme or look at people much deeper and much better level, and they're very tuned in, and so that's why if any doctor comes to a meeting, they'll find, instead of just plugging along with just the superficial issues, that you have got doctors that are a whole different level and really working on these issues, solving those issues. So instead of waning, I'm glad your doctor jumped in and what was your name of the doctor that you mentioned?
There's a couple, Beth McDougall, Christine Green, Eric Gordon, and Dr. Klinghardt.
Okay, so you found several professionals that were all in the same wavelength.
Yes.
Yeah, and so I think that's why I'm glad you're here.
Yeah.
So I'm glad that you were able to spend some time with this live streaming community, and it was and it's a blessing that you're there and coming on strong. So thank you very much.
And you can get better, and you will get better.
Thank you.
Yeah, thank you.